More than 10,000 children are born with congenital heart disease in Kenya every year, and the Ministry of Health estimates that over 200,000 children below the age of 18 are currently suffering from a heart condition. Dr. Gikonyo, the founder of the Karen Hospital and the Heart to Heart Foundation, says the high cost of heart surgery has locked majority of these children from accessing the much-needed help. And as Emily Chebet reports, this year's Heart to Heart Run event, scheduled for Saturday, targets to raise over 45 million shillings in aid of heart surgeries for a number of needy children across the country.
In 2018, after completing high school, Peter Ayoro, who is now an employee at the Karen Hospital, underwent a heart surgery after suffering for 2 years. Ayoro, who is an accountant of the Heart to Heart Foundation, says his work is more of giving back to the society, having received help from the foundation that is focusing on children who are suffering from heart condition.
Maybe I was born with a problem, or maybe I acquired, because from childhood I had issues growing up, and of course my granny would take me to the herbal. There are many things they did, but I think it's because it was not attended to at that early age that now it affected me when I was old.
According to Dr. Gikonyo, the founder of the Karen Hospital and the Heart to Heart Foundation, rheumatic heart condition that is acquired is easily treatable when diagnosed early, but majority of parents are unaware of the symptoms.
When the baby is breastfeeding, they tend to feed. They feed a bit, then they stop to breathe. The other one is they sweat a lot. In some conditions is that there is darkening of the lips and the tongue and the nail beds, and because of what we call blue babies.
Walking, you cannot walk fast. I used to hear, when I was in high school, I used to hear people running, and I would literally go down, not because someone hit me or not because I ran, but that tension and fearing, of course, the teacher will beat me. I don't know what used to happen, but I would just fall.
The annual Heart to Heart Run, organized by the Karen Hospital, scheduled for tomorrow at the Carnival Grounds, targets over 25,000 children participants and other stakeholders in support of the many needy children who are suffering from the heart condition.
These are the children who are going to be the corporate executives, they're going to be the managers, they're going to be working, and they're going to be making decisions on how their companies utilize monies. So it's important that these children start to understand why it is important to give back, why every shilling counts that they raise that will go towards another child who will get heart surgery.
The rise in heart disease in our country in the last 40 years is immense. Diseases called heart attacks that we now used to see when we were medical students are now a day-to-day routine, and many people in this country now have that problem.
The heart surgery for one child costs up to 1.2 million Kenya shillings, a figure that is too high for majority of Kenyans, let alone those from a humble background.
The cost of surgery or cost of medical care today is very high, but I believe it can be controlled. It can be brought to a level where government can afford it, by controlling the costs, reducing wastage, and making sure that the resources we have are utilized 100%.
Every shilling goes a long way towards a child's surgery, and therefore we really I would urge anybody who's listening, donate to the Heart to Heart Foundation. We do have a pay bill number. It's 517-800, and you can give any amount that you wish.
Hundreds of thousands of children below the age of 18 are living with heart condition in the country. Half of them require surgery, which is expensive, and they have been left at the mercy of well-wishers. These stakeholders are now calling on the national government to ensure health care is affordable to all. Emily Chebet, Citizen TV, at the Karen Hospital in Nairobi.